all, I will be presenting the role of combined immunomodulators in severe steroid intolerant VKC. So as we all know, VKC is a very common problem in India and often presents with acute episodes. So steroid agents have to be prescribed to control the severe inflammation. However, their long-term use can cause glaucoma and cataract. Steroid-induced raised IOP is seen in 28% of VKC eyes, out of which 5 to 6% develop glaucoma and might need surgery also. So steroid-sparing agents are being investigated. Management in these cases is often difficult and challenging due to fewer options available as well as biological variation of the disease. Both cyclosporin and tacrolimus have been proven to be effective in these eyes. However, due to different mechanism of action, we believe that a combination of these drugs might have a synergistic effect leading to a rapid resolution of inflammation. So we conducted a retrospective study and included all patients who were referred from glaucoma clinic for the management of these patients and could not be started on steroids. They were either responders or had glaucoma and cataract, and patients who had already on immunosuppression were excluded. We included 22 eyes which are steroid responders, 13 had glaucoma and 4 had cataract, 10 patients were male and mean age was 13 years. Out of all, 91% had mixed variant of VKC. And other features were giant papillatosis, pseudogerontoxon, scar and keratoconus. Clinical features were graded according to Muller et al. And these are the images showing the grading of clinical signs. When the patient was referred to us, we first started cyclosporin 0.1% because all were having severe limbal involvement, and olopatadine, lubricants and anti-glaucoma was continued. Then at 2 weeks, if the response was suboptimal, then we added tacrolimus BD for 3 months in tapering dose, which was stopped after that, and cyclosporin was then continued for 6 months. So all patients were evaluated at 2 weeks of combined therapy, then at 1 month, 3 months and 6 months. The mean total subjective and objective score from baseline reduced after starting the treatment, but the change in the total score was much more after the combined therapy. Similarly, in the objective score, percentage of eyes which showed reduction in score from 3 to 1 was increased from 60 to 100% after combined therapy. Thus, the absolute change in the total score was much more. Photophobia and conjunctival hyperemia resolved within 4 weeks and no recurrence was observed till 6 months. These are the images showing resolution. Mild irritation was observed in a few eyes, but medication had not to be stopped. So the reason why we included tacrolimus is that there is a difference in their chemical structure. They have different mechanism of binding to different category of proteins, and tacrolimus has a higher potency pharmacologically. So we evaluated their synergistic effect. The limitations were a small sample size and it was a retrospective trial. So the synergistic effect was effective, and whenever cyclosporin efficacy is suboptimal, we can add tacrolimus to improve the efficacy. However, tacrolimus is still an off-label drug. So we started with cyclosporin as an alternative to steroids. For long-term control, we use cyclosporin itself. Also, the rate of resolution of symptoms, as you all know, is fastest with steroids, and the combined use of both may lead to rapid resolution and control of symptoms with reduced recurrence in cases as compared to only cyclosporin. Thank you.
I'm just curious, if an ophthalmic concentration of tacrolimus is available in India, how is that? I mean, why is that an off-label use?
No, it is not approved by FDA because still this long-term safety is not proven.
I'm talking about the drug controller India. So
yes, ma'am.
Tacrolimus is available in India in an ophthalmic
but there are some reports that in long term there are some reports of lymphoma if the patients are applying on eyelid skin or something. So that's why we always preferred cyclosporin, and if it is not getting controlled, then we added tacrolimus.
Take at least 4 weeks to start the action, either of the one. If you have both the CSA, cyclosporin, but if you have involvement itself, you have to stagger off the steroid responder if it is to salvage the eye stem cells. To start with the close monitoring start the steroid. It's good reports on the study. You can give it the synergistic effect of the whole immunomodulator.
Because their action is slightly different. So they.
How long you will continue the cyclosporin? How long?
6 months we continue.
Both 6 months.
No, tacrolimus we stopped at 3 months, and then only cyclosporin, so it was maintained till 6 months.
But it has already been proven that for VKC patient, tacrolimus is much more effective compared to this.
A lot of reports are available, but we just wanted to see the combined effects.
Okay, thank you.
Very good, sir.
Thank you, sir.